What happens in business is that when things go bad and things get in trouble, there's been dozens of economic studies. Where does the cost of benefits come from? Does it come from the pocket of the organization or the pocket of the employee? It comes from the employee. The employer takes money away from compensation of other sorts and puts it into benefits. It is a choice being made by the employer on behalf of the employee. And so when benefits costs go up, what happens to wages? In this company, instantly, you started to see that for the first time in their history, wages fell below inflation. In lieu of getting paid more, they got more benefits. If human nature is to exchange what you want to give to get something back, the equation has suddenly shifted. We had a crisis at this organization of not just health, but skills and motivation. You can't think about health in isolation. If you go chasing this trend, this huge trend, by trying to see how many diseases or defects in these words you can fix, you're not going to succeed. It's been a difficult year. Would you like your annual bonus in cash or Prozac? That trade-off comes tongue-in-cheek in a lot of ways. When individuals can't get rewards in the form of bonuses or recognition or opportunity, where does that compensation come from? I got tired in the early 2000s of seeing study after study showing the effect of health on productivity, because every study said, which disease has the most effect? Was it asthma? Was it allergies? Was it cardiac disease? Was it hypertension? I wanted to know, where did health fall in other issues? So we did a survey of about 2,000 Americans. Health problems, if you see there at the second one, was next to last in terms of importance. What affects people's productivity is morale, motivation, communication, inspiration. We don't have an epidemic of poor health as much as we have an epidemic of wanting to be at work and feeling rewarded. Over and over and over, I go to organizations and they say, we have this great fitness center, we have this great program, nobody wants to use it. And yet, when they do a morale survey, many of the employees don't feel like the company cares. So I get back to my question, why should I? It's not a great mission statement, but we'll revise it if things get better. How many people show up at work and they wonder what they're doing there? Am I being rewarded for the good work that I'm doing at the same time that somebody's telling me that I probably ought to lose weight and quit smoking? I actually talked to a medical director where she said that the expectation was that the employees work 80 hours a week. But she wondered if I could recommend a healthy sleep program. Sort of makes sense. Sort of makes sense. So if we look at this easy explanation, we just need to improve health. It's going to save us money in healthcare costs. It's going to reduce absence. It's going to improve productivity. Sorry, Freudian slip. The question I have is whether we've looked in the wrong places. Is that really the straightforward way that we can improve well-being and business performance at the same time? And I started to realize 5 years ago that we had it backwards. Instead of trying so hard to invest more in health to get improved performance, I now believe that you need to reward good performance in order to improve health and well-being. So I ask you to keep your mind open as I give you the evidence of how to do that and why you should do that. And let go of the idea that it's our job to change somebody else's human capital for their own good. to take money out of their wages to put into benefits and programs for their own good. Take their assets and tell them what they ought to do with them, rather than operating as a business for business' sake. There are 3 areas that we talk about at the Health is Human Capital Foundation. One is how to share rewards, to align incentives. And just to be clear, when I talk about incentives, I am not talking about dangling $50 in front of somebody hoping they will take a questionnaire. I am talking about the inherent rewards in the workplace that people manage in their own best interest. And I'll be clear about that. The second type of incentives are shared responsibilities. And then the overarching theme is to promote human capital growth. So let's talk about rewards first. And we had people fill out, or at least take a look at your green sheet. And you don't need to pull it out now. Hopefully you've taken a look at it. And these are really simple proxies. It's not the same way that we do it analytically, but it gives you a sense of what rewards look like. If I perform well, can I earn more? Do I have some control over that by having an idea over how the reward is going to get determined? I used to be at a consulting firm, and I swear to God that the way they calculated bonus was like the square root of the ratio of the regional benefit over the revenue for the nation minus the number of paper clips that whoever. Do you know how that bonus is calculated? Do you have some influence over it? Is it of a size that's meaningful? Does the company invest in your 401k as a future? Does the company invest in your training? Can you get cash back if you don't use your sick leave? Or are you forced to leave the job to get the value of the benefit? These are the rewards. And hopefully you filled it out and counted how many yeses you got. And if you are willing to share, how many of you got 7 or more yeses? Yay. How many of you, keep your hand up, got 5 or more yeses? How many of you got 3 or more yeses? Anyone, go ahead and put your hands down. Anyone less than 3? Sorry. So why are we worried about rewards for work when this is really a conference about health? Well, what we started to find is that when you align incentives and you reward productivity, people improve their performance measurably, and a side effect is that they take care of their health. Now, have any of you been self-employed? I've been self-employed about 6 years out of my career. When you don't work when you're self-employed, how much do you get paid? And so when somebody, as it happened with me, said, let's go learn to snowboard, the week before I had some big presentations that I had to fly to. And my friends call that the chicken, fill in the blank, the chicken event. I didn't go, because I could just imagine missing out on an entire month of revenue by being hurt. If I had full disability, didn't like my job, hey, I don't care. I'll take the chance. Why should people care if they are rewarded for doing good work, being at work? They care more. But if you look at the country, only half of all workers are eligible for a bonus. Only a third of those who are eligible for a bonus know how it's calculated exactly. So we don't do a very good job of connecting effort with rewards. But when you do, look at some of these relationships. They are fascinating.